We are Oklahoma's premier emergency medical service.
We are a force of 500 dedicated medical professionals.
We are recognized as one of the best emergency care providers in the country.
We are EMSA.
We are EMSA.
We are EMSA.
We are Oklahoma's Emergency Medical Services Authority, providing care to more than 1 million Oklahoma residents in the Tulsa and Oklahoma City areas and almost a dozen other communities. Our medical professionals are dedicated to providing the best possible care and highest quality of medical services to our patients. EMSA crews in both Tulsa and Oklahoma City continue to handle an increasing number of emergencies, all the while maintaining our important call response time standard of under 9 minutes. A recent 3-month stretch set new all-time records for call volume, with Eastern and Western Division crews answering more than 10,000 911 calls each month. The most visible change citizens can see is our expansion and conversion to brand new mobile units. Our fleet of state-of-the-art ambulances has grown by more than 10%, each one equipped with the latest medical equipment and special mobile data terminals, assisting our crews in finding the quickest route to the emergency when seconds count the most. Our crews log more than 3 million miles each year, responding to the needs of our patients. In the last year, our personnel have been recognized for their expertise on a number of levels. Other regions in Oklahoma look to EMSA for advice in building plans and teams to determine better ways of providing emergency care in areas outside our coverage areas. EMSA employees are utilized as instructors in basic and advanced disaster life support classes around the state. EMSA paramedics are used by area hospitals to help train their personnel in cardiac care and seizures.
Do you have any medications there that he requires you to take?
At EMSA, technology plays a part in each call from the moment it's received. Our communications centers are located right alongside police and fire dispatchers, allowing for the highest level of cooperation during emergencies and even in disasters. The facilities utilize the latest in satellite-monitored computer-aided dispatch systems. Our practice of system status management allows our crews to station themselves closer to the citizens in need, saving precious minutes during life-threatening emergencies.
So we're going to check inside the airway and make sure that's all cleared out.
The latest in technology aids in the training of our paramedics and EMTs. The addition of computer-controlled training mannequins allows our medics to experience every possible emergency and complication before they hit the streets. In our units, the latest technology makes it possible for medics to send 12-lead cardiology information directly to emergency departments.
It's just like having a cell phone attached to the monitor, and it transmits the 12-lead via Bluetooth to the hospital so that the physician can put hands on the actual 12-lead that we're getting in the field, and he can call in the cardiologist and the cath lab team so that we can get better results with our cardiac patients.
Ventilate.
The unit features a built-in metronome to guide CPR compressions and ventilations. It not only monitors blood oxygen levels, but also carbon monoxide levels in the bloodstream. The new LifePak 15 is already saving patients' lives and EMSA medics valuable time.
I had a call response on a gentleman in his 50s who was having an acute MI. He was having a heart attack right in front of me. From the time that he called 911 to the time that I got him to the hospital was less than 20 minutes, and it's all because of the new state-of-the-art technology that EMSA is providing for us.
All we have to do now is we just hit the plus button and it raises the cot straight up.
Another new addition at EMSA is the Striker Power Cot. Now our medics can safely raise and lower up to 700 pounds with the simple push of a button.
We make sure that we have the best and the finest equipment out there available so that we can both provide for our medics and the patients. We want to make sure that the medics have what they need so that they can work in a comfortable environment and not have to worry about injuring themselves or lessen the chance of injury. And then the same thing with the patients. We want to make sure that we have the best equipment with them so we can provide them with the best care.
I've been involved in EMS for 20 years now, and I can't think of a more exciting time to be involved in cardiac arrest care, trauma care.
Dr. Jeff Goodlow is the medical director for EMSA and the fire departments in Oklahoma City and Tulsa. He sets the protocols and procedures used by all EMTs and paramedics in the field.
What our medical oversight team wants to do is support our medics and EMTs by giving them the best protocols possible, not only from an easy to understand and implement standpoint, but also the most aggressive protocols in patient care possible. And so it is a very important part of what we do. We spend a huge amount of time on that, combing the literature, literally not only in the United States, but around the world to find the best outcomes, what makes a difference for our patients, so our patients here in Oklahoma City, they can have the absolute best care possible.
All of these things together make EMSA one of the premier emergency medical providers in the entire United States. Our cardiac survival rate is second only to the city of Seattle. EMSA's Board of Trustees voted unanimously to renew the contract with Paramedics Plus for the next 5 years. And finally, there is the human factor. Like always, our medics have exhibited the extra effort and time to show they have a real concern for our patients.
Winter storm bearing down on Oklahoma. We do have ice in the metro.
Record-setting blizzards in both Oklahoma City and Tulsa revealed the non-stop commitment EMSA medics have for their fellow Oklahomans. Along with the Red Cross and the State Department of Health, EMSA set up and maintained an emergency medical clinic at the Cox Center in Oklahoma City for the hundreds left without power by the storms. Over a 2-week period, our personnel treated more than 500 patients at the shelter.
They've been everything from, just not feeling well, general sickness, cough, to severe shortness of breath and chest pain.
MGL capsule, CAP. Okay.
EMSA is a driving force behind disaster response in Oklahoma City and Tulsa. During the recent blizzards, the medical emergency response centers were full of activity, coordinating 41 hospitals and 8 different EMS services in 7 different counties. In times of full-scale medical emergencies or natural disasters, the MERC is manned by representatives from every level of the medical emergency community, making sure each patient goes to the appropriate facility and each hospital has the supplies needed, even as Mother Nature shut down travel for more than 1.2 million Oklahomans. EMSA medics in both Oklahoma City and Tulsa have been recognized nationally as genuine heroes, receiving Stars of Life awards in our nation's capital from the American Ambulance Association. We are EMSA, High Performance EMS, and the effort from everyone in our organization, from the mechanics to our medics to our administrators, is what makes us the gold standard in emergency medical care.